Welcome to Muscle Fix Mobile episode
7.
Today we have, as always, our regulars, Dr. Vincent DeFurry, Doctor of Chiropractic Care. We have Dr. Nicholas Kuzmanowski, PT. Very excited to have bodybuilder and VP of Sales of orthopedic parts, if I'm not mistaken, Darren Strephens. Pleasure to have you on board today.
Thanks for having me.
Hey, Darren, how are you?
Good evening. Sorry, I almost said good afternoon. It's good evening.
Nice meeting you.
You as well.
Lots to talk about. I know that you have experienced Nick's treatment, so we're going to get into that momentarily. Before we start talking about that, we understand that you've placed in a couple of competitions. I think Mr. Universe, you said, Nick, and I don't know if you want to just elaborate on that a little bit.
Tell us about your accolades and how much of a rock star you are, Darren.
Well, thank you. It's tough to do, and I'm sort of a humble person, but I used to compete in bodybuilding back in the day. I would say maybe 10 years ago, before all the different, categories started making their way into the aesthetic sports, such as men's physique and classic bodybuilding and all the different segments that really allowed for people with subpar genetics to actually be competitive. So when I started competing in men's physique about 5 or 6 years ago, it was a category that really just fit more of my lifestyle, being able to be professional in a world outside of bodybuilding, but also be competitive on the national level and hopefully, knock on wood, professional level in the very near future. So been doing it about 5 years now. I placed 7th at NPC Universe last year. And this year, if all the competitions go off, hopefully, I'll be going down to Masters Nationals and trying to turn pro there. And if I don't turn pro there, then we'll go back to Universe again and try to get the pro card there. So.
Awesome. Really cool. So, I mean, you sent us a few before and after photos. So tell us about that. How'd you go from, a normal looking dude to, all sorts of ripped? Like, how did that work?
I think some of it, I will say, is muscle memory. I think it's very real. I have been in very good shape in the past. Back in, I was competitive in college. I was a wrestler, and then also, bodybuilding after college. I let myself go and really focused on my professional career, and really, I guess, rededicated myself to this sport. And it came back pretty fast. So long as you're extremely dedicated, and I say extreme because it is an extreme sport, but so long as you're extremely dedicated, I think it comes back a lot faster the second time around than when you really had to add it or really go after it the first time around, if that makes sense.
Oh, of course. No, absolutely. I mean, your experience, like I said, you're dedicated. I mean, so what about your diet and fitness regimen? Did you, obviously, you're wiser and older, what did you change, I guess, from your younger years, or what's been your experience?
Absolutely. I never really pushed it enough is what I learned. Never really dieted hard enough, never trained hard enough. And I think this time around, what really made the difference is that I pushed it farther than I thought I could go. It was also the first time I actually hired a coach. A coach by the name of AJ Sims, Cement Factory on Instagram, really had, just pushing me to a level that I never thought I could go to. And that meant, dieting even more strict than I thought possible, a lot of fish, and pushing the cardio, pushing the weight training, just taking it to a level that, it's way outside of your comfort zone. And when you're training yourself and doing it all yourself, you tend to stay within that comfort zone, I think, a little bit more than we care to admit. Mm-hmm. And having somebody push you and continuously drive you to take it to the level you didn't think you could is really crucial, I think. So.
Awesome. So Nick was telling me that when he was treating you, seemed like you had a lot of scar tissue, which I think is pretty normal for most people who are, dedicated athletes such as yourself. So that being said, have you had any serious injuries, or did you just experience a lot of tightness over the years, from training? Or?
Yeah, absolutely. I mean, I think it all started when I was training kind of foolishly in the early years, kind of not really putting a lot of thought or science into my training and just picking up heavy dumbbells and lifting them. Kind of just that meathead approach of just lift heavy weights and eat a lot of food and go home.
Right.
And I think over time, especially being taller, I think your biomechanics really make it a little bit more difficult. Your center of gravity is kind of all over the place when you're a lot taller, when you're doing things like squatting and, when you're starting to get into the mechanics of it all with lever arms and so forth. It's a challenge for a taller person. And when you train incorrectly for so many years, you really really put some injuries on your body, I think, especially being as tall as I am.
So how tall are you, for the record?
6'1".
Okay. Yeah, very few pro bodybuilders are that height for that reason. Most of them are like 5'6", 5'7", because if you think about it, it's easier to fill out a smaller frame. And plus the weight is also traveling a shorter distance. You literally have shorter limbs. That kind of height is, I think, conducive to becoming a meatball, more or less. That's what your goal is.
It's easier to puffy.
So Nick was saying that you had tried this Jimmy Bluff technique. Can you tell us about that?
Yeah, I connected with Jimmy Bluff before he started working on.
Asked a little bit about the muscle versus Mr. Bluff's technique. Give us a little pros and cons contrast what you experienced.
Yeah, absolutely. So I started working with Jimmy Bluff before he was working on Jay Cutler and some of the other big names. And kind of he was refining his technique, I guess is the best way to put it. It was a weird feeling when he worked on me. It was unlike anything I've ever really experienced from a sensation standpoint. It almost felt like you had bubble wrap under your skin as he was working his way, across your muscle fibers. It worked. We measured my quads before and after when he did it one time, and I grew a solid 2 inches just from all the blood flow, and everything popping and the fascia just releasing. But to be honest, it was a very short-lived sensation and short-lived result, so to speak. After I would say probably 2 days, it went right back to, being tight and choked off the way it was prior to the treatment. So having that said, when we did our treatment together last weekend, I think the difference was that the results were a lot more permanent. And I use that term loosely, but it lasted a lot longer. And I got a true pain relief. I think with Jimmy's technique, it was just a release of the fascia. Mm-hmm. There was no true pain relief per se. So I think, in comparison, contrasting that treatment to the one I had last weekend, I felt a lot of pain relief from last weekend's treatment.
Right.
Let me kind of dig a little bit into that, because that's important stuff we should note. So with the Bluff technique there, from what Darren's explaining to me, and he is world famous, so thanks, Mr. Bluff, for what you do. With a fascial component, like you said, that bubble wrap, that's a perfect way to explain it. So when it's a lighter scraping technique or manual technique, you're popping those little knots, which again is great, and it's a super important part. We don't appreciate the myofascial release, and we don't understand the fascia, how complex and important it is in our bodies in an orthopedic world. So great technique. It's the beauty and the art form of these different soft tissue techniques. I guess what we do with the muscle fix mobile technique, or the unique method that we use, is kind of 3 different types of massages, which Darren can kind of attest to. We do like a deep scraping using a surgical grade steel tool, which allows me to go way deeper, not only into fascia and soft tissue, but also ligaments and even tendons. So the instrument assisted techniques, which is more new technology, Graston, sports massage, it's a little more effective. And then what I like to do and choose to do is a reverse pressure massage, which is the cupping technique. Again, cupping has been around for thousands of years. So we kind of scrape out the layers, if you will, and then we kind of suction through those layers to release everything from toxins to scar tissue to just pain. And then I think in Darren's case, we also did, which we do, is the percussion or the vibration, right? So again, allows me to penetrate up and down these different levels. And a little guy like Darren, guy's huge. I mean, he's just tremendously one of the biggest guys I've ever had the pleasure to work with, and was just tough to get in there. But with the tools and instruments, it's fairly easy because, again, it's just a matter of me leveraging more with these steel tools into this big guy and the tools as well. And Darren basically didn't peep or move, so I'm pretty aggressive. So speak a little bit more, I guess, into your training, what you felt that day, the next few days, the permanency. Like, how are you even feeling today with your workouts and your training as you're getting ready for the next big pro card show?
Yeah. Like I said, it was very, it stayed with me in terms of the pain relief. And what I felt, interestingly enough, is that I didn't have necessarily all the pain relief just in the spot that you were working on, but it was in other aspects of my body as well. Like my wrist had a lingering kind of nag that really, I think, you got just by working on my brachialis, you had released some of that tension that was building up all the way down into my wrist. And then when you're working on my extensors and flexors and up into my elbow, and we were talking about the tennis elbow and the golfer's elbow, all the different tissue work that you did in that area really released everything in that arm. It wasn't just the area you're working on, but really releasing the tension all up into the shoulder. So it was, like I said, it was a pain relief, not just in the spot that you work on, but pretty much that entire extremity.
So again, another huge thing, the key word here, which again, we obviously are doing this to educate the world and the population, not just cool bodybuilders, but just all of our patients. A key component is the kinetic chain, right? Looking as a human being, as not just an elbow or just a wrist or just a neck. So in Darren's case, we started with kind of upper traps. He was resting neck, and then we worked our way down these kinetic chains. The truth of the matter is, like in Darren's case, or anybody really, to be honest with you, Joe Schmo, non-bodybuilder, we can work on different body parts, even not just when you're injured or broke, but as a preventative measure. And really, again, what we do with the muscle fix and even chiropractic is, God forbid we say maintenance or preventative words, right? So this is a component that you invest in with the bluff technique, with recovery, with us, that can help not only when you're not training, being ready for that next doubles, triples training that we always talked about, or that you do right now as you get closer to showtime. So that's a huge component. And again, the feedback is very, very great. So again, I'm glad you had some relief, and like I said, it was my pleasure, and thanks for doing the treatment with us.
Yeah, absolutely. It was actually my pleasure. All the pain relief.
Whole point is that we're kind of advocating medication and surgery-free, treatment. And like Nick said, hopefully taking care of an issue before we have catastrophic failure and you need emergency care, basically. And that's what we're trying to pass education along on that. Dr. T over here can tell you a lot about how the nervous system works, how the spine comes into play. And again, it's so helpful for people in general, not necessarily someone who has already been in like a terrible car accident or something, to have these type of adjustments, as with the cupping, same concept. It's great preventative care.
I forget if I asked if you had any chiropractic or adjustment or manipulations. I don't know if we ever got a chance. We only worked together once. So can you tell us a little bit about your chiropractic background, or kind of what your thoughts are on it? Because you're also in the orthopedic world. So I'd like to kind of pick your brain a little more about that.
Absolutely. So when I first started my orthopedic career, I was actually a trauma consultant. So I was working with a lot of the surgeons in the operating room, and they would call me in at 2 a.m. if there was a fractured femur or a destroyed ankle or whatever, whatever came in that night. I would have to assist the surgeon in putting in the implants. So I got to see the body kind of from the inside out a lot, and got a true understanding of the soft tissues and all the different bones and mechanisms of injury. But I also saw a lot of total hips, a lot of total knees, and I saw the I guess what could possibly happen when you don't take care of your body, I guess is the best way to put it. And I just see kind of the state that these patients are in, and it's once you get to that point, it's already such a downhill snowball effect. I mean, you're buying a couple of years of time on a patient's life, unfortunately, at that point. But yeah, so that's what I think the most triggered me into making sure I really take my recovery seriously. That's why I go to a chiropractor every week, lifting doc up in Nanuet. And he's a power lifter, so he understands, understands and doesn't judge what we do to our bodies on a daily basis. Sometimes you go to a chiropractor, you tell them what you do, and they shame you. And but no, it definitely, I like to work with recovery modalities with therapists and chiropractors that understand what we do to our bodies on a daily basis, and truly, I guess, are able to treat an athlete versus just a sedentary person. I think they're very different in how the treatment modalities that need to take place. So yeah, I've learned over the past couple of years that recovery is everything. You can beat the hell out of yourself in the gym and you can eat all the right things, but if you're not recovering, you're not gonna be a good athlete at all. You're not gonna be able to come back and put full force into that next training session, or in my case, the muscles are just gonna look tired and deflated and weak if you don't recover correctly. So it's very, very, very important.
Excellent. So who's the chiropractor in Nanuet that you see right now?
The lifting doc. I'm trying to remember his actual name. He's up in Pearl River.
It's on the tip of my tongue too, because I think I know him and he's a great guy too. Big guy.
Yeah. He's a power lifter up there.
Yeah.
Big guy, and which is also, I think, very beneficial when you're trying to get cracked, and it takes a lot of weight to get me to release. So he's able to do that.
I'm 6 foot and about 205, 208. I have patients that go up to 300 pounds, 6'8", and I do a very unique technique called advanced biostructural correction, which is something that definitely, it's actually the next step beyond traditional chiropractic. So it helps you with a lot of postural issues. You'll see your body actually starting to cavitate or change forward anterior translation, how you stand, and basically from the things that we're able to do because of that kinetic chain of activity, we basically adjust you from head to toe. And, Nick can attest to that. I take care of him on a regular basis. In fact, we do the SFMA, which is like a screening functional movement assessment before and after, and we can see the range of motion improve almost dramatically. So that's one of the things I did. And the situation for me, why I got into it was because I've been training for 50 years. I'm going to be 65. And the bottom line is, I've been doing it, man. I started at age 15. I still keep going. And with the gym being shut down for months, the interesting thing, rather than just weight training, I wound up going into CrossFit. And I have to tell you, I love it because it incorporates parallel. I mean, we're doing clean and jerks, we're doing deadlifts, we're doing what the hell is it? The thing when your arms are out to the side. I just got a gap in my head, but it's plyometrics, it's calisthenics, it's an aerobic component. Like the other day, we did as a post recovery thing, we did 2,000 meters on a rower. So it's like after we did the snatches, that's what it was beforehand.
Yeah.
So you do 3 to 5 reps, 10 sets, and then you come down too. But sometimes you're integrating burpees and everything. So all in all, is I like the functional movement aspect of it for me myself, because I've had some injuries in the past too, as well as I take care of myself. Bottom line, that's what you're doing, and I advocate that. And that's a smart thing to do, because the investment you make in your body not only helps in your career, but your longevity as well. And as you saw when you'd open these people up and you severe, osteophytic spurs and, just wear and tear, degeneration of bone, just adhesions and scar tissue. This is the stuff that people come in and say, okay, fix me. And they want to do it. Here's the typical patient. They want to drop their body off at 9, pick it up at 5, or else do it over the phone. And like it done in 1 or 2 visits. They say, this is a committed relationship. I'm the coach, you're the quarterback. I'm going to help you get there. But if you don't participate, it's never going to happen. So doing the things that you're doing with Nick, with my, Muscle Fix Mobile, breaking up the scar tissue and adhesions, doing the work with the corrective biomechanical care is a big factor. And of course, you're working on your diet. I'm sure you work with that as well. Because like every aspect of when we talk about like weight loss, we do, as one of the primary things, we do functional medicine and weight loss in our practice. And I tell patients 84% of what you're going to do is going to come from your diet. It's not going to be training. You could train like a beast. In fact, if you overtrain aerobically, you boost your cortisol level and your body just wants to hold on to the fat anyhow. So there is a true science behind all of the things that we're talking about. And it's really important that you become educated to that. And that's where it's all at. Especially if you're an elite athlete, you have to do it. I say you don't put regular gas into a Ferrari. You know what I'm saying? You may get away with it in a Volkswagen, but you're not going to get away with it in a Ferrari. So you better treat yourself better. So
yeah,
I'm glad to see you taking
but all
care
you
of
guys is we seem to kind of alienate, Darren mentioned there, like, or we judge on bodybuilders, or we judge on like old chiropractors doing CrossFit, and like it's not our job as PTs or chiros, or really like just the medical world, even as within the orthopedic world, we kind of judge our patients or our followers, or whatever you want to call them. And, it's not our job to say, hey, Darren, do this or don't do this. Our job is to kind of like fix you and give you that option, whether it be through good chiropractic or the ABC method. And again, like Doc mentioned, I can attest to it. I've been in the rehab world for over 20 years. And I tell Doc all the time, first of all, I've never seen the ABC method done before, let alone actually experienced it. And I've been consistent like now the last 3 weeks, once a week. And from energy to like pain to like just clarity, like life is good. It's wild. And again, like Greg mentioned before, like let's not wait till we're broken. That we think about medicine like, okay, like Doc said, like I'm broken, now fix me. Again, we have to all be equal partners into this recovery stuff. So on that note, you mentioned, we were talking about tonight's theme was athletic soft tissue work and recovery. What are your latest, greatest tricks in the top 3 recoveries in Darren's world? Now going into the show and pro card. If you want to reveal your secrets now, let us know.
Well, I'll tell you, the one big thing that I've learned over the past couple of years is, specific to diet, is the digestibility of everything. And making sure that your digestive system is working, because you're only as good as what you digest. They always say you're only as good as what you eat. That's bullshit. It's only as good as what you actually can digest. And if your digestive system isn't working right, then you're not going to get the nutrients to your muscle. And it doesn't matter what you're doing from a recovery standpoint or what you're doing from a training standpoint. If the proper nutrients aren't getting to your muscles, you're not recovering, bottom line. So I learned that, taking in a ton of fish oils, high-grade fish oils, not the crappy ones, but really good fish oils. I've also been, in terms of, I guess, recovery directly, I have an inversion table I use on a nightly basis. I use about 5, 6, 7 minutes. I'm trying to work up to 10, but my head feels like it's going to explode after a while.
That's getting used to.
Yeah. I have a Theragun, which I use on a nightly basis as well, usually on the muscles. I work the day before, the day after. And then my wife, actually, interestingly enough, has learned a very elementary scraping technique. So she tries to scrape me, and I love her to death. She does actually a pretty good job for not knowing, what she's doing for the most part. But she enough to get some blood flow and turn the skin, red, and really get some, I guess,
make sure she's
release
not
a little bit.
And
but it's very superficial. I mean, she only does a couple minutes, but it's enough to really loosen me up, I guess, or hold me over until in between, larger treatments by actual professionals.
Hey, Darren, I have a question for you. So
You
work, and you obviously have to work to support yourself and your family. Your spouse works as well?
Yes, she actually is in orthopedics as well. So
okay, so how many hours a day do you have to train? How many hours do you have to dedicate to the production of producing the right meal, recovery, and everything else? Because I don't think a lot of people realize how much work goes into what you do. They just say, okay, big guy, muscles, and everything else. I mean, they realize some dedication, but they don't know the extent of what needs to go on and how you have to integrate it into your life.
It's funny you say that. So it's a lot of work, but it becomes a balancing act for your time. And just like anything else, if you really want to make it a priority, you're going to make it a priority. So you can be a vice president of a publicly traded company and still do this sport and be competitive at it. So it's possible. It's just a lot of prioritizing of time. My wife and I do all the cooking 1 day a week and just bang it all out. And then divide it up into meals. I do the cardio when I wake up in the morning at 6 in the morning, hop right on my spin bike and just get after it. and then I go to weight train after we're all done the Zoom calls all day for work. And then, do some cardio before bed, and also do all my recovery modalities. So I eat about 6, sometimes 7 times a day. And it's just everybody that knows me, especially in orthopedics, like when I work with the surgeons and so forth, and then everybody that works for my company, they all know it's a part of my life. And they know that there's a good chance that when I'm on a Zoom call, they're going to see me eating a meal as well.
There you go.
Kind of the way it is. But I've actually seen it rub off. And it's almost like like people want to start doing it as well after seeing me. I actually work with a surgeon that just competed at North Americans. She's a pediatric hand surgeon, and she just turned pro herself. So I guess my mission is to show that you can be a professional. You can have a career completely unrelated to the sport, and still be successful at it if you really want it.
Like everything else, right? Dedication.
Exactly.
Perseverance.
Exactly.
And persistence. That's it. Excellent.
Exactly. And my wife's also in the sport too. So that also helps to have a supportive partner.
Oh, yeah.
So.
Well, I mean, either that or divorce, right? It's going to go one way or the other. It's like, there's only so many excuses you can give after a while. So
Very true. Very true.
Yeah, very good.
So if it were possible, would you do the pro thing full time? Like, would you switch over, or is it always going to be kind of a side hobby for you?
It's always going to be a side hobby. I mean, I love it. Don't get me wrong. But the first and foremost, the money is not what it once was in this sport. I mean, the muscle mag advertisements and all the different things that used to exist, the contracts, they're no longer there, especially in the day of social media.
Right.
So it's not a financially beneficial sport anymore, number one. And number two, I mean, I love what I do for a day job, so I absolutely love orthopedics. I love getting to be in the operating room on a fairly regular basis. And I love helping patients. So I wouldn't want to stop doing my day job.
That's great.
Even if I could.
Good.
So
how you doing with your sleep? Especially if you're training late at night aerobically, because sometimes it kind of kicks up the adrenal function. Do you find yourself a little bit having some difficulty, or just at the point, not too far exhausted, but you can get some somnolence? Does it take you some time to sleep? And yeah. So that's one of the critical issues that happens for a lot of guys who train late at night. It's like everybody has circadian and biorhythms. It's like taking a policeman and switching them around, or a doctor. It's like, okay, work 9 to 5. No, now we're going to have you work 12 to 7. It's like, you keep doing that. It doesn't work out too well. And especially it's like, to this day, the two people give a knife to a doctor and have them vary those hours, and give a gun to a police officer and take away all those times, especially in the crazy world we live in right now. So, have you ever used theanine and arginine before? I'm sure you have. Basically, the arginine basically cuts you up. But the theanine actually helps with sleep. You may want to look into it. Google it. I don't want to give you too much information, but it's definitely worthwhile looking into.
No, I absolutely do. And it's funny you say that. I noticed the more I drop my carbs, the higher my cortisol level gets. And right now we're 4.5 weeks out, so the carbs are next to nothing. I mean, probably 100 grams today. And I noticed that my cortisol levels just go through the roof.
Yeah.
Right. So, that wakes you up in the middle of the night, to be honest with you.
Well, because what's basically happening is your blood sugar is dropping so low because your insulin levels are up, and your body's catabolizing itself. Which is what you want, to eat up the fat, but you don't want to lose muscle mass too. Have you ever been on a body composition analysis machine like the Tanita scale that breaks everything down to visceral fat, cellular hydration? Because we use that as a monitoring device in the office. That would be a great thing for you to probably own personally, so you don't go to too much of an extreme during the time of training. You can adjust things, and you'll know how to do that between diet and everything else that you go through. But recovery is an important factor for sleep. So all I'm going to tell you is just watch your heavy training, especially aerobically at night.
Absolutely. And we actually invested in a mattress. It's called 8 Sleep, and it controls the temperature throughout the night and adjusts itself as you're sleeping to help you get more sleep. But it also keeps track of your metrics, which is interesting, and keep track of your resting heart rate, your all kinds of different heart rhythms that I don't quite understand yet, which I'm trying to learn about. Trying to think what else. Just all these different metrics that really, measure your recovery, how much REM sleep you're getting versus deep sleep, and all these different, So it's pretty cool. I mean, if you're a science geek like myself,
Right.
and really love to learn more and more and more about this stuff, getting these little,
Yeah.
fun little widgets.
When's your next competition?
So it's 4.5 weeks. So it's October 14th will be my first one. It's a Wednesday, I believe. Yeah.
Yeah.
So
one of the things I'm going to ask Nick for you to do, he's going to talk to you about the product that we use personally right now, which will definitely boost things for you. And I don't want to talk about it on the air right now, but it has something to do with your hormone balance. Because right now, it's going to be very interesting. Take a look what's happening with blood flow, monitoring level, and hormone levels as you go down through these next 4.5 weeks. Things are going to be bouncing all over the place. And it's good that you have something that can regulate your body temperature, because it's like, when you've been laying on a pillow too long, it's too hot, you flip the pillow over, you put it back down, sheets go on, sheets go off again. We got the, it was like the comfort sleep to the next level, because big guy, little woman, so everybody's got a different level of the body. And now you got something to regulate temperature, body levels, and so on and so forth. But we have a little magic bullet for you to help with it. And it's 100% within the realm of what you're doing without a problem, because it's very cool stuff. Now, I've been using it for 2 years. It works great. It's all natural stuff, so it's good. Yeah, but it's nice to be able to engage and talk, because as you can see, we keep it very down to earth. Nobody wants to get on and listen to a podcast with a bunch of people talking clinically after a while. They want to know about real results with real people. And you know what? You have a day job, you have a family, and now you have a career, or as an athlete as well, that you still love and do. How old are you?
38.
38. Okay, you're a kid, just like Nick too. And I'm the old man of the group, but I keep going. What's that?
It's a little bigger than me.
Yeah, just a little.
just a little over here. Yeah.
Cool. All right, Mr. Greg, anything you want to add to our conversation with Darren?
No, I'd just like to say that it's awesome having you, and I think we'd like to follow up with you and see how the competition goes, and see, based on the results of this competition, what you're going to do different, if anything. We continue on, or very interesting stuff. But we wish you the best, and we really do think that you will succeed.
I'm going to do something too before we go. And I don't normally do this, but Darren, I seem to like you, and I want to help you out with something. We use something in our office that's great for recovery and body function. You know anything about PEMF, pulse electromagnetic field therapy? Ever hear of that before? The coolest thing in the world. I'm going to give you my website, tefurywellness.com, and you'll see the spelling of my name at this point. Go on there and look at the things on the PEMF, and just look at some of the videos. And basically worked with we're working everything at a cellular level, the electronic component of the electron potential, and atoms got protons, neutrons, and electrons. Well, heavy training, depletion of certain nutrients, and high levels of stress, both physiologically, emotionally, as well as biochemically, can deplete our electron potential, as well as Wi-Fi, Bluetooth, cell towers, computers, and all these different things. This machine just ramps your body up to heal better. So it's something that we integrate into the practice that we have, and Nick and I work together, as well. And we have a mobile and a brick and mortar situation. The brick and mortar is in Fairlawn, New Jersey. So I invite you for a session on me, and I think you're going to enjoy it a lot. And I think you'll know, Nick will talk to you about it more. So that's a gift.
Okay.
You can check
Great.
it out.
I'd be excited to do that.
Oh, definitely.
The way Doc likes to summarize it, because again, same thing. Doc educating me and giving me the gift of these things. You know what grounding is? You probably heard the word grounding before, right?
Yes.
Okay.
So the pulse is grounding machine version, or a clinical version on steroids.
Yeah.
So,
this is the 10 hertz machine. You can't get that. I mean, there are some different things out there that are great products, but it doesn't do what this does. And let's put it this way. We made a significant investment about 1.5 years ago on this machine, and I use it in all aspects of holistic healthcare, as well as recovery, post-traumatic injuries, athletes. We have a lot of athletes. We have a 52 years? How old is Chris? This guy's amazing. 52 years of age, retired executive, heavy-duty elite senior baseball player. And we've taken him through blown-out disc, torn iliotibial band syndrome. Nick and I have worked on them both together, and he's made great strides, and where nothing was working before. Right, Nick?
He bought one at home, by the way, because he
that's right. He bought one of these things.
It's about $50,000.
Yeah.
So Basically, we're saying we want to electrocute you and see how it goes, more or less.
That'll be it. It'll really turn you on. It'll actually help you with your sleep and other things too in recovery. But check out the website or go to pulsecenters.com. That's the company, and they have a bunch of information, but you'll love it. I'm telling you. Amazing thing. We use it all the time. Like Nick popped in the other day, and he didn't realize I was in the office. I was sitting on a machine because I was at CrossFit from 8 o'clock to 9 o'clock, and we did some heavy-duty training. And before I started engaging with what's going to happen, I wanted to pump up, that cellular rehab a little bit more so. So it's good. You'll enjoy it.
Nice. I'm excited. Yeah, absolutely.
Definitely. Yeah, you check it out.
Awesome.
So,
Sure.
so
Very
Doc,
cool.
tell us a little bit more. Give us your handle, give us your website, and then Darren next. Tell us more about your IG. Where can we follow you? Get you ready for the show. We want to follow and support you, man. So Doc, take it away.
You talking to me
I
next?
think he means Darren.
Darren.
First, I want to hear Doc's more his information, his IG and his website, and then Darren. I'll wrap it up with Darren if that's cool.
Oh, I see. That's okay. Well, our website is Taffuri, TAFFURI wellness.com. And you can get all the information. And our office is located right in Fairlawn, New Jersey. And you'll find all the information you need right from there. And with the Fury Integrated Wellness Centers is basically one of the things you can find us on Facebook and Instagram as well.
Cool.
So where can we find you, Darren?
So my IG handle or Instagram handle is corporate_aesthetics. And I'm on Instagram. I do a lot of different updates on my prep, on what I'm eating, what I'm training, what I'm doing. And I also have a few clients as well. I only train elite women that do bikini, figure, and women's physique. So I'm very selective. Well, I'm very selective about what I choose.
Okay.
I'm not one of the cookie cutter coaches. I put a lot of time and effort into my clients. So I don't just choose anybody or take anybody on. Usually I want to work with somebody that's going to give me everything. They're going to put everything in, and I'm going to put everything in for them. So
Excellent.
Cool. Very cool, Darren. You, sir, are a genius. I have to remember this one. It's like we only deal with the bikini women, I'm just joking. So anyways,
I'll tell you why.
He turned. Notice the color he kind of just turned too. He's as red as a beet right now. His mind is working. Hey, by the way, you asked me IG before I was up. It's Taffuri_wellness. That's for Instagram.
Very good. Well, pleasure, absolute pleasure having you, Darren. We hope we could bring you back on. We want to know how you do.
Definitely.
I think
Absolutely.
We'll leave it at that.
Where is the competition that you're going to, by the way, Darren? Where is the meet?
So it was supposed to be originally in Pittsburgh, but Pittsburgh's having some COVID issues.
Right.
So they moved that one down to Orlando.
Okay.
And we're going to have that one in Orlando. And then if I don't turn pro at that one, the Universe was originally supposed to be in Teaneck, New Jersey.
Really?
But we're also having COVID issues up here. So they're doing that one in Charleston, South Carolina. So.
All right, cool. Well, we wish you the best of luck.
Thank you. Right. I'll definitely keep up with you guys.
The offer is there, so take advantage of it.
Oh, I absolutely will.
All right, cool.
Very cool.
Nice
All right, Darren, have a good one.
All right,
All right,
thank you.
If you like this video, please share, like, and subscribe. Thank you.